Okay, so I have already verified my MAR, made sure that my doctor's orders, the MAR match my doctor's orders. So the second part of our med administration is I'm going to the medication room, and in the med room I'm going to go ahead and do a medical hand wash. And I'm going to pull up my computer. And at this point, I'm just going to be working off of my MAR because I know that I've checked it and it's correct. And so, make sure I've got everything that I need here. All right, we're going to start with the first medication. Just get everything that I'm going to need out here just real quickly. Okay, this is going to be the first check. Again, we're in the medication room. We did our medical hand wash when we came in. And so I'm going to, in the medication room, we're going to do 2 med checks before we go to the patient's room. So I have Smith Brad, date of birth 4/24/1957. NPH insulin 5 units, subcutaneous AC, and I'm going to be giving the 9 o'clock dose. So in my hand I have Practi NPH insulin, okay? It's U100, and the expiration date is 5/2026, so it is intact, okay? And if this was brand new, I'd pop the top. If it was used, I would be looking to make sure the date, time, and initials that it's within the 24 hours. Even though it has a expiration date, once this is opened, it's only good for 30 days. So then I also have my insulin syringe. It is a U100, which matches my U100. I'm making sure that the package is intact. And there's an expiration date down here on the end, which is 2/2026, okay? So once that I've made sure, and my NPH insulin is my NPH insulin, it matches my medication there, and I'm going to be pulling up 5 units. So before I do that, I'm going to go ahead and get my label ready. So I have NPH insulin. We're going to be doing 5 units, and it is sub-Q, and I'm giving the 9 o'clock dose, and then I'm going to initial there. Okay, so I've got that ready. I'm also going to be, before I finish, I'm going to be date, time, and initial because this is a brand new one. So I've got my date, time, and initials so that whoever uses this knows when that 30 days is up, okay? All right, so I'm going to go ahead, and NPH is an intermediate. It is cloudy, and so the precipitate usually is at the bottom, and we've got to roll to make sure that the precipitate is in the solute, which is a solution. Okay, once I've done that, then I'm going to go ahead and get my alcohol swab. I'm going to clean the top of that really good. I'm going to go ahead and get my syringe out. We've already checked to make sure it was the correct syringe. I'm going to get my trash over here so I can okay, and I'm going to pull up 5 units of air because you want to give and take. So I'm taking out 5, so I'm going to put 5 of air in. Okay, making sure that needle is very small. Put that air in. I'm going to turn it over, being very careful. And with this one, I can overdraw because I want to make sure, a lot of times putting it up in the light to make sure I don't have any bubbles. And then I have 5 units. So I want to turn this so that I have to have 2 licensed personnel verify that I have the correct med and the correct dose. So I go to my first licensed personnel. What do you see? they should tell me that they see NPH insulin 5 units. That tells me I have the correct med and I have the correct amount. Go to my second licensed personnel. What do you see? They should tell me they see NPH insulin 5 units. Again, I verified that I have the correct med and I have the correct amount. Go ahead and take that out. I'm going to put my needle there because we want to do one-handed recap. And these are a little difficult to put in there, okay? And so we've got the on there, just making sure that I still have the 5 units. And I want to put this down below so I can make sure I still have the correct amount in there. Okay, I still have my 5 units. And then I'm going to set this off to the side right here. Okay, then my next medication is going to be my Digoxin. So I have Smith Brad, date of birth 4/24/1957. I have Digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60. I'm going to be giving the 9 o'clock dose. So in my hand I have Digoxin. Now this one is 0.25 milligrams and expiration date is 11/2026. So Digoxin. Now, since this is 0.25 milligrams, I'm to give 0.125 milligrams. So I need to make sure this is where I can score it. So I'm going to cut this in half, and I'm only going to give a half of the pill, which will give me my correct dose of 0.25 milligrams, okay? So I'll know to make sure that I score that. I'm not going to do it yet because I need to wait into the patient's room because I have to hold if less than 60 beats. So I'm not going to score this till I get into the room. But just knowing I've got the right drug, and then I'll score it to give me the correct amount. Okay. I've got plenty of alcohol there. We never reuse any kind of alcohol swabs. Okay, so I have Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstitute with 2.1 ml, 1% lidocaine for a final solution of 350 milligrams per ml. Give 350 milligrams of final solution, IM BID. I'm giving the 9 o'clock dose. So in my hand, I have Rocephin 1 gram. It says reconstitute with 2.1 mils of 1% lidocaine, 2.1 mils, for a final solution of 350 milligrams per mil, final solution of 350 per mil. And I'm going to give 350 milligrams, so that means I'm going to drop 1 mil when I get this reconstituted. So it also says that I'm supposed to reconstitute with lidocaine. I've got 1% lidocaine 1%. The expiration date's 1/2027. The expiration date's 11/27. These are intact, so I can use those. So I'm going to go ahead and use a 3 ml syringe because I've got to draw up 2.1 of the lidocaine, and I can accurately draw up 2.1 with a 3 ml syringe. Then once I get through drawing it up, I'm going to change it to the appropriate size needle. I'm giving IM, and I've got a 22 gauge 1 inch needle, and it's intact. Expiration dates are within expiration dates, making sure those are intact, okay? So I'm going to go ahead and get ready to start mixing. Now, before I go on just a little bit further, I'm going to go ahead. I've got my date, time, and initials, and I need to date, time, and initial my my NPH. We had talked about that because since it was new. All right. You don't necessarily have to have gloves on unless you feel like you're going to get anything on you. So I'm going to go ahead and just put some gloves on. But if I'm not going to be touching the meds, I don't necessarily have to have the gloves on, but sometimes these squirt out. Okay, so when I open this, the syringe and the needle are not attached. So I have to make sure that I don't cross over, so I'm going to pull this down. I don't want to cross over that needle, so I'm going to pull my syringe out, making sure that end is not contaminated with anything, and I'm going to connect those two. It's a lure lock, so I'm going to lock it in place. And now I'm going to go ahead and I'm going to pop the lids off of these. But even though I popped them off, I'm going to go ahead and get my alcohol swabs ready. Okay, so it says I'm supposed to use the 2.1 mils of the lidocaine. Don't ever pick it up off the table and reuse it, okay? Just throw that in the trash. And so 1% lidocaine, and I've got my 1% lidocaine. And so I'm going to go ahead and pull back 2.1 because we give and take. The 2.1 of mil. So I'm going to put the air in. I'm going to turn it over, make sure my needle is in the solution. I'm going to draw back. I'm going to get any air that is down at the bottom. Okay, I'm going to push it because this is the first solution. I can push it back up in there, then pull my needle back into the water, into the solution. Pull back till I get 2.1. Okay, there's 2.1. And I'm going to put it in my Rocephin. Okay, and you can see automatically it's trying to equalize the pressure in there. So I'm going to go ahead. It took that out. I'm going to go ahead and take that out. I am going to recap this one-handed. Okay, my needle's already in there, so that I can roll this and make sure that that powder that's in there okay, looks like all my powder is dissolved. So that means that I have a final solution of 350 milligrams per ml. My order is to give 350 milligrams of a final solution, IMBID. Of course, I'm giving this 9 o'clock, so 350 milligrams per ml, which means I need to drop 1 ml of solution. Okay, so we put the 2.1 in, we took the 2.1 out, and now I'm going to go ahead and put the 1 of air. So give and take that off. I need to re-clean that because I've been crossing over. Okay. Put my air in, and then make sure that my needle, I'm turning it around so I can see that my needle is in the solution. And I'm going to draw up 1 ml, because 1 ml equals 350 milligrams. Okay, put that back on there just real quick. Make sure we get all the air out. Make sure the air is at the top. Go back to 1 ml. So I have 1 ml in there. Okay. Sometimes they'll squirt out at you. And so at this point, I'm not going to recap that. I'm going to go ahead and change out my needle. So I'm going to go ahead and deploy the safety. Okay. okay? And I'm going to make sure I open this one so that I'm not, and again, that was a 22 gauge 1 inch based on the fact that I'm giving IM injection. My patient's subcutaneous, I can make sure that needle length is long enough. And then I'm going to go ahead and take this off. I got it on there pretty good. Okay, making sure that that doesn't touch, and then I didn't cross over that new needle, because that's the needle that I'm going to be giving with. Put this in the sharps container. Okay. So I have my 1 ml. I'm going to go ahead and lay this down right here, and I'm going to lay, and I could have done the same thing I did with my MPH, labeled it beforehand, but I've got Rocephin, 1 gram, mixed with 2.1 mils, 1% lidocaine. Final solution of 350 milligrams per meal. I'm giving 350 milligrams, and it's in 1 meal. And the route is going to be IM. I'm giving it at 9 o'clock and my initials. And again, I want to put it down below so that I can read my label, but also I can make sure that I still have my 1 meal, because if I don't have 1 meal, I won't be giving an accurate amount of medication, okay? Since I opened those, I'm going to date, time, and initial. So if they are used again, glove to glove, skin to skin, I took my gloves off, so I'm going to do a medical hem wash. Okay, and now I'm ready to do my last medication. So I have Smith Brad, date of birth 4/24/1957. Tobramycin eye drops, 1 drop in left eye daily. I'm giving the 9 o'clock dose. In my hand, I have Tobramycin optic drops, and expiration's 1 of 2028, and I'll be giving 1 drop in the left eye, okay? And so I've made sure that the container is intact, and so that was my first check. So I took my medications out of my container, did my first check, and as I did my first check, I prepared, did my first check, prepared on until I get to the bottom. Okay, so now, and I made sure that I don't have anything else in here, and there's not any other here, so we know we've got all the meds out. Now I'm going to go ahead and do my second check. We have Smith Brad, date of birth 4/24/1957. MPH insulin 5 units, subcutaneous AC. I'm going to be giving the 9 o'clock dose. In my hand, I have the Practi MPH insulin, the U100. The expiration date was 5/2026. It's date, time, and initialed. Okay, it was intact. And so I drew up my, and so that's the vial, but I also have to check my, because I took medication out, read my label. So in my syringe, I have MPH insulin, 5 units, sub-Q. I'm giving the 9 o'clock dose in my initials, and I've got to make sure that I still have 5 units, okay? So I've gotten that verified, and I'm going to go ahead and put that back into my container. Okay, do my second check. Smith Brad, date of birth 4/24/1957. I have Digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60 beats per minute. I'm giving the 9 o'clock dose. In my hand, I have Digoxin, 0.25 milligrams. Expiration date was 11/2026, so it's okay. But this is 0.25 milligrams. I'm to give 0.125 milligrams, so that's half of this tablet. It is a tablet that I can score, so when I score it, I'm going to give a half a tablet. And I'll have a score so that when I can do that in the room. Okay, Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstitute with 2.1 mils of 1% lidocaine for a final solution of 350 milligrams per mil. Give 350 milligrams of final solution. IM BID. I'm giving the 9 o'clock dose. So in my hand, I have Rocephin 1 gram, reconstitute with 2.1 mils, 1% lidocaine for a final solution of 350 milligrams per mil, okay? 2.1 mils of 1% lidocaine, final solution 350 milligrams per mil, okay? So I've got that, and we'd already checked the expiration date, 11/27. And then I also, this is lidocaine, 1%, and it's 1/2027, 1% lidocaine, and I took 2.1 and reconstituted it here to get it to 350 milligrams. Then in my syringe, I have Rocephin 1 gram mixed with 2.1 mils of 1% lidocaine, final solution of 350 milligrams per mil. My dose is 350 milligrams, so in 1 mil, and I still have 1 mil, and it's IM, I'm giving the 9 o'clock dose and my initials, okay? So I've done my second check. I have Smith Brad, 4/24/1957. I have tobramycin eye drops, 1 drop in left eye daily. I'm giving the 9 o'clock dose. In my hand, I have tobramycin optic drops, optic means eye, expiration 1/2028, and I'm giving 1 drop in the left eye, okay? So, and it is intact, expiration date was good, and so that was my second check. So, I don't have any other medications here, so I've finished my second check, making sure I've done my second check on here. My meds are in there. So I'm going to go ahead and make sure I have everything that I need when I go in there. So I've got a washcloth, a tissue, and I've got alcohol swabs for doing my giving my medications. I've got a cup, I've got a pill cup, and so now that I've got everything ready, I've done my 2 checks in the medication room. Now I'm going to get ready to leave the medication room. And when I leave the medication room, I'm going to go ahead and do a medical hand wash. And during this whole time when I am preparing medications, I want to make sure I keep my meds in my peripheral so that I can see my meds at all times, okay? So once I've done my medical hand wash, I'm going to gather my stuff, and then I'm going to go ahead and leave the medication room, get ready to go to my patient's room.